I'm Yuri McKee. I'm the medical director and managing partner of East Valley Outpatient Surgery in Mesa, Arizona. I have a passion for doing great surgery, and that requires us to continue to work with industry and make better devices that give better patient outcomes. I've always been driven to make things better and constantly improve our processes wherever I go. We should always be doing that. I had an amazing experience as being the first surgeon in the world to use the METIS microscope in human surgery. Amazing popping red reflex, very stable red reflex, the quality optics I'm used to seeing in Hog Strike. The controls were familiar, and yet there were so many more options to adjust the microscope in surgery or to have presets work with me in surgery. The stable red reflex on the METIS scope is a product of 3 different illumination sources. 2 are coaxial and 1 is tangential. And this allows a lower luminosity inside the eye to reduce light toxicity to the retina. It also allows for that red reflex to be stable across a variety of surgical maneuvers and eye positions. The most important procedure that takes advantage of a red reflex, I would have to say, is cataract surgery. We're working inside the eye in a very limited space. We need depth of field at certain points, we need more detail at other points, and we need a strong red reflex to keep the detail high throughout the entire surgery. But furthermore, we're casting shadows within the red reflex that show 3-dimensionality. So when you see the videos of doing a simple capsulorhexis, you're going to see this rhexis in ways you've never seen before, 3-dimensionally through shadows and light. And then as we move through surgery and the eye moves around a little bit, we're not losing our red reflex through hydrodissection or phacoemulsification because of the dual light source for the red reflex. This is something that once you experience it, you'll never want to go back. So the LEDs here are not an afterthought. They were designed carefully, thoughtfully. A lot of effort went into making a high quality, long-lasting LED with a very high CRI. This is going to give you better imaging during surgery and colors like you didn't know existed when you were operating with older scopes. My LED lights have thousands of hours on them. They do not need to be changed. They'll last the lifetime of the scope. Hogstraw as a company has a strong dedication to ergonomics. They work with several surgeons around the country and around the world in both their slit lamps and their surgical microscopes. Everything that they've built their optics around and their scopes around relates to ergonomics and prolonging surgeons' health and longevity in their career. We're having less and less eye surgeons coming into the market and more eye surgeons prematurely retiring, oftentimes for their physical health, especially their spine. And so every surgeon should be able to set this microscope exactly what's correct for them in surgery so that their spine is straight, their neck is straight, and they're looking straight ahead during surgery. Avoiding neck and back problems goes beyond the operating room. You want to go home, you want to see your kids, you want to see your wife, you want to live an active life, and you can't do that with a messed up neck or a messed up back. So you can't have your career ruin the rest of your life. On any Hogstripe product, you're going to see the highest quality optics. And you're going to require those optics to be advancing for, as we talked about, the stable red reflex, true color index, and things like that. So without the highest quality optics being produced, all these other things fall by the wayside. We really need to start thinking about the microscope as a platform, just like we think about so many other things that we use, like our phones, even now our cars. And these platforms can be expanded on in the future because they're digital with enormous technology. We've got so many great ideas that we'll be incorporating this microscope for the next several years. And that's the real beauty of this microscope. We've started with the rock solid quality of a Hogstripe microscope, and now we can expand this platform without buying a new microscope every 5 years. One of the features of a digital microscope is the presets that we can program into the microscope. Having a completely customizable microscope with all these presets simply saves you time. With a few pushes of buttons, your microscope's ready to go for the desired surgery. There's not a lot of setup and there's not a lot of changing different settings within surgery. Everything's ready to go for you as you like it as a surgeon. And when one of your colleagues comes into the OR, a few pushes of a button and now the microscope knows it's them and set up for their surgery. So one of the most important examples of these presets is the glaucoma tilt function. Instead of asking the nurse to come and try to set the angle that I would like, I've preset this angle in the microscope With a touch of a button, the motorized tilt function will go exactly to the angle that I'm hoping for MIGS surgery. I'll complete the MIGS portion of the surgery. One more touch of a button, and the microscope goes back into its normal operating position. But one of the really cool functions is, as I grab the microscope and bring it onto the field, the recording can be programmed to start automatically once I'm focused on the eye, and then stop as I move the microscope away from the patient. There's no more forgetting to push the record button, especially when something very interesting in surgery happens. Hogstrite has demonstrated to me over the years that they're absolutely devoted to improving their products. They won't release something until it's ready to be released. We go over the design, we go over the beta testing ad nauseum. It takes years to develop these products and make sure that their quality is of the absolute highest aspect. So there's no question about the quality of the optics, the quality of the design, the quality of the build, the quality of the image that we're seeing through our surgical microscope. And absolutely everything from the design to the manufacture to the delivery of a Hogstrite microscope is second to none. And I think surgeons already know that based on their use of Hogstrite slit lamps.